waiting for people to join. Hello, waiting for people to join. Hi, everybody. So good to see everyone. Welcome. Welcome, everybody. So nice. We're just waiting for Alana Frank to join us. Hi, Alana. How are you?
Hi. How are you?
Good to see you.
You too. I'm excited.
Me too. It's so great to be here. Now, I know it's a little bit before 8, so we can kind of wait while people kind of get on board. But hey, everybody. So glad y'all are here. Great to see everyone. Yay. So glad everyone's here. So did you have a good day?
A long day, but a good day. How about you?
Okay, great. Same. Also, very good.
Amazing.
I'm excited to talk to you and to share all about the Jewish Fertility Foundation and my thoughts on COVID and fertility. So it's going to be great.
Amazing. And what a perfect week, Infertility Awareness Week.
I know. I'm so excited. I think if you want to, we can go ahead and start. Did you want to kind of introduce yourself and the Jewish Fertility Foundation? And then we'll get into the questions, and I'll introduce myself as well.
Perfect. Thank you all for being here. I see many of you are joining. I'm Ilana Frank. I'm the CEO and founder of the Jewish Fertility Foundation. For those of you who don't know about our organization, we are focused on 3 main areas. We want to help support people as they are going through their infertility journey in 3 ways. One is we help financially. We offer $1,000 to $10,000 grants. We offer interest-free loans, as well as clinic discounts to those individuals and families who are experiencing infertility. That's important, but also the mental health component is just as important. And we offer free support to anybody experiencing infertility. And I should say that, you know, during COVID, which we're going to get into, it's allowed us to rethink some of our strategy. And now everything is virtual like this. And we're able to offer free support to anybody, regardless of religious background, in several ways who are experiencing infertility. So like many of us in this space who run support and educational awareness, it's personal. I started this organization because I suffer from infertility. And my journey started about 11 years ago when I got married. I thought that, you know, you have sex and you have millions of babies. It didn't quite go as expected. And my husband and I we're from Atlanta, but we had just moved to Israel. And so for those of you who aren't aware, Israel is a country, kind of like Canada or England, that offers its citizens socialized medicine. We pay our taxes and the medical system is free for us. So I was just learning about that. And after only a few months of trying, but being married for over a year, I went to my doctor and I said I just feel in my gut something is not working. I'm used to getting something pretty quickly, and it wasn't working for me, and I didn't understand why. They didn't do any testing, and they immediately asked, well, how long have you been married? I've been married over a year. I didn't tell them that I was only really trying for over 3 months. So we weren't on birth control for the entire marriage. But anyway, they put me on Clomid, and I was surely going to get pregnant because it is a drug that stimulates ovulation. I was going to get pregnant. And we tried this for several months. I remember flying back to New York, like going to tell all pregnancy tests, and this is for a few months, and I was not talking about it with anybody. I was in the middle of Israel. I'm an American, and we weren't in an area that was heavily populated with other Americans. I'm like, I didn't know how to talk about it. I literally thought I was the only person in the world experiencing infertility. Wow. And I literally did. And my friends were calling me and telling me from America, yeah, like, we're going to have a baby. We're going to have you know, the bris or the baby shower and then the birthdays. And I was like going to work every day, like, oh my God. And I finally confided in my aunt who worked in the medical system in Israel. And my parents didn't know anything. And I was like, you have to keep this a secret. Like, I don't know what to do. I'm not getting pregnant. And they're like, do you know how to have sex? Do you need to take a vacation? Kind of the typical things that sometimes people say. And eventually, after like joking aside, even though it was like a dagger in the heart, she gave me a phone number of a doctor who was very well known in Israel who did fertility treatments. And in Israel, it's common if you feel like paying, or you are American like me and can write a check, and we're not talking big numbers here, but I was able to go to his private clinic, which was in the basement of his house. It literally was like that. And we went there, I think it was like 8:30, 9 o'clock at night. And we, like, my husband did his business in the bathroom. He never checked me. Like, literally never checked me. I was in stirrups, like in his basement. My husband was in the bathroom of his house. It wasn't like his home office, and that's allowed in Israel. But we did this for months. He like literally took my husband's sperm and looked under a magnifying glass. But like, what the heck did we know? There was nobody. I wasn't telling anybody. And I don't know if this is how you have babies. Like, okay. Like, my husband wanted to do everything in his power to do it for me. And I didn't know any better. And I wanted a baby. And I was desperate at this point. Months and months and months were going by. Sex was not fun at all. You know, my husband didn't know what to do with me. I was a mess. Now I'm on like hormones in addition to the IUIs. And we were just a disaster. People where I was working were coming up to me. In Israel, they're very blunt. And they're like, well, why aren't you pregnant? What's going on? Like, I was already in my 30s. What's going on? You're married. Like, do you not want to have kids? Let me tell you why I want to have kids. And like, we hear a lot of this now, but at the time, I mean, this was like 10, 11 years ago, I didn't even know what to do. And I still was not telling people. And after months, my husband and I were like, this is weird. Like, this is weird. Finally, we found another doctor. It took some time to get into the system. And the first thing he did was check me. And we're talking like, this has already been a year. And he's like, yeah, your tubes are blocked. You need to do IVF if you're going to get pregnant. And he like typed on his computer. And thank God I was in a country of socialized medicine, because I didn't have to pay thousands and thousands and thousands of dollars for my first 2 children. IVF at that point, I don't want to say it was easier, but it worked. It worked the first 2 times. I did lose each time the kids were twins. I have an 8-year-old and an almost 7-year-old from the same batch. Thank you. Each of them were twins, but at one point we did lose one of them. Even at the time, it wasn't even as devastating as like thinking back now. When we moved back to America, I had 2 kids under the age of 2. It was the first time I really started talking about what I went through. And I started talking about it because I was with other moms, and we were kind of comparing, like, how much did your baby cost? How much did your baby cost? And I was like, my babies were free. Like, literally, I think I paid like $200 total. And I had extra embryos in the freezer. And I knew in my heart, like, my family was not done. We always wanted a big family. And I was leaving my kids at home and traveling back and forth to Israel, and I was not getting pregnant. And I used all my embryos. And then what? My husband did not want to go through the process again of retrieving my eggs. And so we said, okay, we're going to try to adopt. And for several years, we decided that we were going to try to adopt a baby from the foster care system. And then I realized after about a year of training, essentially, with the foster care system, like, I wasn't that special of a person. My husband wanted older kids to help a sibling unit, and I just wanted a baby. Like, I just wanted to give something to this baby. And so we said, okay, we're going to adopt a baby. it's really expensive to adopt a baby, and we couldn't find somebody who wanted to, you know, share that experience with us because we already had 2 biological kids and they thought we were going to love our biological kids more than us. And fast forward, we were able to find a donor for an embryo. And my third son, who is now 1, was born via embryo donation.
Congratulations.
So thank you so much. So that's my story. I mean, I just feel like I'm one of the lucky ones, honestly. And that's where I am today. Before I
You are very lucky. Thank you so much for sharing that story with us.
Yeah,
it is hard to do, and
well,
I'm very happy for the outcome.
Absolutely. I mean, and I was not talking about it for years and years and years and years, and now I can't stop talking about it. But I do want to make sure that everybody, I see many people joined. I want to make sure that you do check out the Jewish Fertility Foundation. You like us on Facebook. You follow us on Instagram. And again, our organization, for those of you who are just catching us now, is the Jewish Fertility Foundation. We do 3 things. We help people grow their families by offering financial assistance by way of grants, interest-free loans, and fertility clinic discounts. Currently, though, that is offered in Atlanta and Cincinnati, but we are expanding. And we also offer emotional support for anybody, regardless of religious background, who is experiencing infertility. So again, not that there is an upside to coronavirus, but the upside is that we're virtual now. All of our support groups are free. Our Fertility Buddies program, where we match peer-to-peer up, it's all free of charge. Anybody can join. So we really encourage you to go to jewishfertilityfoundation.org. So today, I'm going to stop talking. I am going, you're so excited to introduce Dr. Valerie Libby. We have many questions for you. A lot of our, I don't want to say readership, a lot of our Instagram followers and our Jewish Fertility Foundation followers are really excited to ask you questions. A few of them, I should say all of them, really want to get to know you. As do I. And who is this lady in blue coming all the way from more north than Atlanta to talk to us today, and who's going to be joining Shady Grove Fertility in Atlanta? So why don't you just tell us a little bit about yourself?
Sure, I'd love to. Well, first, thank you so much for having me here. I'm so happy to be here tonight with all of you, and I'm so happy to talk to you, to meet with you, and I can't wait to work with you. I think the Jewish Fertility Foundation really is something very special. And when a couple of years ago, when I made the for sure decision I was going to move to Atlanta, I remember thinking I wanted to start some sort of foundation for Jewish people with fertility issues, and it was already started. And not only was it started, but now it's been going for 5 years, and you have just wonderful grants for people of all religions. And now we have the virtual support groups, which are available to everyone, which I just think is wonderful, and I can't wait to work with you and be on your medical advisory board.
Yay!
Yay! So thank you for having me. My name is Valerie Libby, and yeah, I am from Atlanta, and I was raised there. I went to Woodward Academy, and I have a father and 2 brothers that are all urologists. So I grew up talking a lot about reproductive medicine, especially male reproductive medicine, probably to my mother's dismay at dinner, but it was very interesting. And I also grew up, obviously Jewish, going to Temple Sinai, and really a big part of our culture, as you know, and many cultures and many families out there, is reproduction and having children. So for me, I always wanted a family. I still do. I remember when we were growing up, we all wrote, how tall we were as we were gaining height, and also when our predictions for when we thought we'd have children and how many and all this stuff. And I remember age 23, 3 kids, 2 boys and a girl. And it's always been such a goal and such a priority for me. So that is sort of my background, and I think Judaism and all religion and families, I just think that's for me, it was very important. So I grew up like that. I also really, I grew up loving people. I love people. I love getting to know people, transcending cultural and language boundaries and barriers in order to really know people of all different backgrounds. And so I naturally studied psychology and Spanish in college because of those interests. And then I thought I'd go save the world abroad, doing a master in global public health. And that was fascinating, amazing, studying pandemics, living in Africa. It was just an amazing experience. I loved it. But as we all have probably realized now, preventative medicine is a very difficult field. You're taking care of populations of people rather than an individual person. So you don't, and you're taking care of them by preventing them from getting sick. So it's sort of a thankless profession because no one really can thank you for preventing something from happening. In this case, I think this is the first time in my life that I've seen the world really realize the value of public health because we're actively preventing things from getting worse. And so it's really special to be here today talking about both my love for fertility medicine and my interest in global health and pandemics and stuff like that. So I did that, but then I decided ultimately my love for psychology and human interaction and people and I wanted to go into medicine. So I went to medical school in Texas and thought I'd be a pediatrician because I love kids. But then I realized that I could help people create families, which was obviously a huge, important thing to me. And also have the psychology of like the stressors involved in infertility. And I just love that. So I definitely was like hands down IVF for REI infertility is definitely my field of choice and perfect for me. So I'm so thankful to finally be at the end of the road. I have 2 months left until I finished residency. Yay! Finished medical school, went to residency at North Shore LIJ in New York, and then also at Parkland Hospital in Dallas, which was awesome. Lots of babies. And then now I'm in fellowship in Ohio, but I'm coming back home, thank goodness, finally. And I am so favorite practice in Atlanta, Shady Grove Fertility. Obviously, I'm biased. Great practices in Atlanta, but yeah, I think that it really aligned with my goals and my morals, and I'm so excited to join them. So that's sort of my story. On a more personal note, I am 35, do not have children, not married. Obviously, having kids is a huge part of who I am and who I want to be. So I have frozen my eggs 4 times. And yeah, I've frozen 4 times.
Wow.
And I started when I was 27. I, learned about the field of IVF, which I had no idea existed. So I'm thankful that just being in medical school, I learned about that. And I knew that, I was in and out of relationships in my 20s, and I knew that my trajectory within the field of medicine was going to be quite long, and I wasn't sure if I was going to be able to have children during that time or meet the right person. So I knew that I didn't want to regret not having done this, or not having, at least frozen my eggs to see if that could help me in the future. So I wanted, like that laundry room board says, I want 3 children. So I have like 22 eggs frozen. And I am using them as as a backup in case I need them in the future. But it's been really great because every single time I've gone through these experiences injecting myself, I've appreciated more and more my patients' experiences. And I feel like it is so difficult injecting yourself and learning, like even as a physician, like that gives people these medicines all day, every day. Like I still had to call the nurse all the time on my 4th round and be like, how do I mix this medicine? It's really hard. So I just feel like it makes me a better doctor by doing it. So that is my story.
Wow. 4 times. I can't get over that. That's commitment. And, what's really the first thing that came to my mind is, and I don't know your dating history and I don't want to get too personal, but, how do you talk to somebody that you're like on maybe it's not a first date, but if you're starting to date somebody, how do you talk about this and how do you share with them that, it's important for you to have children, but you've already taken these steps?
Yeah. It's so funny that you ask that, and I think that's one of the questions that I get so frequently, but I'm always shocked to hear it. And I know that that's probably one of the reasons why a lot of women don't do this or aren't as open about it. And I think that's sad. But I get it. It is something that for me, you know, like I told you, everything about me is like family, you know, wanting to have children in the future, wanting to help people have children. So I knew that whoever I would end up dating or marrying would have to be okay, not only with my profession, but with my frozen eggs. And if they weren't, then, you know, then we weren't going to be a good match. So I personally am comfortable with it. I think that just shows that I'm the type of person that's going to take opportunities when given them and not risk having regret in the future. But I can understand that it may be, you know, women may be kind of reticent to or hesitant to talk about fertility treatments, and that's okay. And you don't need to necessarily share that. But the reason why I'm on social media and why I love talking about it, similar probably to the reason why you do, is because I want to normalize this. And I think that so many doctors and patients out there are doing that for us too.
Thank you. I know that's personal, so thank you for sharing that. I really appreciate it. One last question about that. Why 4 times?
Just because I wanted a certain number of eggs to, that in my mind with my calculator, because there really aren't any great calculators out there, I thought would definitely give me 1 child, maybe 2, and hopefully 3. It's like a 60% chance with younger eggs, you know, so I thought. Yeah.
Okay, good answer. So let's get to the reason that you're here today. Mm-hmm. We want to learn a little bit more about what's going on right now with this crazy pandemic. And I know not only are you a reproductive endocrinologist, you also have a degree in global public health, which is really relevant today. What do you recommend to our infertility patients who are trying desperately to grow their families at a time like now?
Yeah, I think there actually is a lot that you can do. I understand that right now, you know, for just having infertility or, you know, not having a family when you want to have a family is so stressful, and you feel like you feel like that is the one thing that's completely out of your control because you can't like fix it yourself. And it's hard, it's anxiety provoking. And then to have the pandemic on top of that is even more anxiety provoking because we have no idea when this is going to end, what the world is going to look like after. So all of those feelings are very normal. And you may feel like you've completely lost control, but I want you to know that now is a really good time, like today, after we get off this, you know, this conference call, this live Instagram show, go out and take control of your fertility if you haven't yet. This is a good time. We as physicians are here. We're still here. We are seeing patients, mostly through telemedicine. We are seeing patients, but we are having consults every day, all day. And we want to be here. We are still here for you. And every clinic is kind of handling this differently. There are, you know, obviously local and state recommendations, regulations, obviously national ones as well, that each clinic is kind of approaching on their own. There are also differences between clinics, like if they're a private practice clinic versus if they're a clinic that's within a hospital-based system that takes care of actively positive COVID patients. So those clinics may be approaching this situation differently. But some clinics are even still open and proceeding like with business as usual, obviously with more precautions. I know, for example, though, at Shady Grove Fertility in Atlanta, they are seeing patients. They have lots of telemedicine visits, and they are even doing full diagnostic workups. And that includes, you know, sometimes it takes a while to get into a doctor. Sometimes it takes a while to do your full workup. And that may include things like blood work, semen analyses to make sure the sperm is good, imaging studies like HSGs or hysterosalpingograms where we make sure your tubes are open, ultrasounds, all of those things we can get done in the meantime. And some patients were even putting through treatment if we believe that that they cannot risk waiting to get their fertility treatment. Obviously, we're doing all of this with incredibly cautionary measures, using a lot of personal protective equipment and social distancing. But we are, our goal is to help you all have families, and we do not want COVID to delay this. So take action, schedule a telehealth visit, and find out what services are available to you where you live.
That's great. I mean, I think part of our fertility grants, part of the application is to really make sure that the doctors are clear about the protocol. So doing all of this pre-work, I guess, is just as important as, getting to the next step. So that's great news.
Absolutely, yeah.
We actually have, so right when this all happened, this pandemic started, we had more than several of our clients thankfully found out that they were pregnant, and they were just they're already nervous as infertility patients who might have already had losses, and now they're pregnant, which is wonderful, and all of a sudden there's so many unknowns. We had to create a separate support group for pregnant after infertility during COVID-19. So we still have this support group going on, but in your experience or understanding, is it safe for our community to be trying to get pregnant right now?
Yeah, great question. And that's a question on a lot of people's minds, and an important question to address. So thanks for bringing that up. There are many guidelines that have come out. The most recent one from the American Society of Reproductive Medicine, I think, was like April 13th, and then there's another one publicly coming out on the 27th. So we're definitely awaiting those. But right now, the data is limited, and there's a few reasons for that. Number one, there aren't that many cases, and there aren't that many cases that have been, collected into case studies. But also, the long-term effects of disease are impossible to study when it's only been around for a few months. So we really can't say with any, with complete assurance that there, whatever risks or not risks we're saying occur with COVID. But what I can tell you is, from the limited data that we do have at this point, there is no increased risk with getting COVID if you're pregnant or if you're not pregnant. So if you are pregnant and you have COVID, you are going to have the same morbidity or the same stressors as a woman that wasn't pregnant and had COVID. And that's really good, because there are some viruses like the flu. If you get that when you're pregnant, it can be much worse. But COVID has not appeared to be like that. And the other thing is, what a lot of women are concerned if it's transmitted to their babies. And again, there is limited data, but the data has shown that there doesn't appear to be any increased risk of fetal effects like teratogenicity. And so that is also reassuring. They've tested babies, like the amniotic fluid, the fluid around the baby, and vaginal secretions, and it does not appear to be in that. There may be an associated risk with preterm delivery with COVID, but that is only a few weeks preterm, and that is very limited data, but some of the data is showing that. So that is one thing that I would recommend discussing with your physician. I would actually recommend discussing with your doctor about all of these risks, and really weighing the risks of potentially getting COVID when you're pregnant with the risks of delaying pregnancy. And both of those things are really important things to talk about with your doctor. It is your right as a patient to have autonomy and reproductive choice, to weigh your own risks and decide whether or not, and to obtain access, or to, and to assess your own risk, whether or not you want to proceed with treatment. So
that's helpful. That's very helpful. Yeah. So I think this is on a lot of people's minds right now, not only around fertility treatments, but with everything going on, the economy and our job security is eek. One of the things that, we as a granting organization, we grant fertility grants, we try to help ease the financial burden. How are people paying for treatments today? And is there anything you can tell us about the financial implications of IVF right now?
Yeah, also a very good question. And everyone is affected financially from COVID, unfortunately. And it is a very difficult time. And IVF is not a cheap endeavor. However, something that a lot of people don't know is that a lot of insurance companies do provide some coverage for IVF services. It, at Shady Grove Fertility, greater than 90% of patients that have insurance do have some sort of coverage for IVF. That's something that a lot of people don't know, and that I do recommend finding out from your insurance provider if there is any coverage for IVF. In addition,
Can I just ask a question?
Uh-huh.
Can I ask a question about that?
Oh, yeah.
So like we always say in the state of Georgia, the state of Ohio, like there's not it's not mandated that you have to have any sort of insurance coverage. So I think what people don't often know to ask or to find out is what actually are some of the things that their insurance might cover.
That's true. Yeah. I mean, yeah, you're right. Different insurances can cover different parts of the process. Some insurances cover tons of cycles, about unlimited IVF cycles, which is also amazing. Some cover just diagnostic testing. Some cover, one round or 2 rounds. Some only cover if you've preceded your IVF treatment with other things like IUIs first to show that you need the IVF. So really, it depends. But there's so many different things that they can provide and that they may provide, and it's changing. And insurance companies are your companies are deciding to acquire those sort of insurance coverages. So I do recommend inquiring about that. Also, there are so many financial programs at these practices that people also don't know about, and it's so important to me to increase access to care at being a public health person, to really normalize IVF because it is so expensive, and so increasing access to care is very important. That is one of the reasons why I chose Shady Grove Fertility to join. They are the founders of the risk sharing program, which is basically an amazing financial program that helps people afford IVF. And for example, you pay a flat fee to undergo up to 6 cycles of IVF. Which is amazing. And instead of having to pay, a lot of money each time, up to 6 cycles of IVF in order to take home a baby. It's a take-home baby guarantee. And if you don't take home a baby after 6 cycles, you get your money back, or you get to do it again. So there's a lot of really cool programs. And they also have this amazing egg freezing program that I love. It's called the Assure program. And let's say you want to assure that I have 20 eggs, or that I'm going to get 30 eggs. So I decide I pay a flat fee, but I know it may take me more than 2 cycles. It may take me 3 or 4. Well, I pay a flat fee that's more than 1 cycle, but less than 2. And I get unlimited amount of cycles, up to 3 to 4 cycles, and it assures me that number of eggs. So it's really cool. There's lots of programs. There's also something called Shared Help, which is an income-based program. And there are other practices that do offer some sort of shared risk type of financial programs. And I do recommend you talking to your practices about what sort of programs they offer. But if they don't offer any financial programs, there's companies like Jewish Fertility Foundation and many others in the United States that do provide grants to help people afford IVF. So I do recommend looking into that as well. And the fertility clinics can help you locate those grants. Also, if you are lucky enough to have parents and grandparents that can help you, for me, it was very helpful. Actually, I couldn't have done it without them. And I recommend, some people don't want to talk to their parents or grandparents about it, but ultimately, I really think that, it's an investment in their children, and, if they can, they probably will. So you can always tap into that, but you really don't know how much it's going to cost you financially until you approach the clinic and have a visit. But you do know how much it could potentially cost you if you never do. So I do recommend inquiring.
That's really helpful. So thank you so much for everything. Let's say I see some of our clients have signed on today. Let's say that they want to use you as a doctor when you move to Atlanta. What's the process? How can they get in touch with you?
Yeah, so again, I'm joining Shady Grove Fertility in Atlanta. I'm super excited. and I'm graduating in 2 months. I will start seeing patients in September 2020. But I am joining a fantastic group of physicians. They're currently seeing patients, and they would love to see you. So if you want to get in, I recommend all of my future partners go to Shady Grove Fertility in Atlanta. There's bunches of practices all around the country, you can. I recommend getting in with them. If you do want to see me, you can call the clinic and ask to be on my list of patients that they will assign me once my calendar opens up for September. And I hope to take care of you, and I can't wait to give back to my community and to help you all in Atlanta. Yay!
Thank you so much for joining us. For those of you who came in late, again, Jewish Fertility Foundation does 3 main things. 1, we offer financial assistance to folks in Atlanta and Cincinnati who are trying to grow their families. And we offer emotional support to anybody, regardless of religious background, who needs our support. Educational trainings like this is what we do as well. So again, thank you so much for tuning in. Thank you, Dr. Libby. I want to give a big shout out to Emily, who is our director of JFF Atlanta. Thank you so much, Emily. And we're going to continue to have more of these. So make sure you follow Jewish Fertility Foundation on social media. Thank you so much.
And thank you for having me. And I also just want to say, if for some reason we did not get to your questions, I'll do my best to go through and answer them all and send you the responses individually, and keep the questions coming. We really appreciate you all taking the time to be here. I'm sure you guys had really exciting plans for the evening during this isolation time, but I really do appreciate y'all all tuning in, and thank you so much. Again, Alana, I'm so excited to work with you. Yay! And I'm so thankful that you created this amazing foundation. So thank you. Thank you all. Great to see y'all.
Thank you.
Are there other Jewish Fertility Foundation organizations in other cities that we can answer?
Sure. So there are, we work with an organization called Hasidah, and they offer, I think it's like twice a year grants, and it's not bound to a specific community. Also, there is an organization in Dallas, Texas. And again, reach out to me, Ilana, ELANA at jewishfertilityfoundation.org. And I'm happy to share, some of the resources within the Jewish community, but I also have resources that are not in the Jewish community for fertility grants as well.
Awesome. Thank you so much, Alana. Have a great night. Okay, bye, y'all.
Bye, guys.